Do you ever feel like you've suddenly forgotten big chunks of your life, like a whole vacation, a job, or even your childhood, without any injury or illness? What if one day you wake up and can't remember your own name or where you live? That might sound like a movie, but for people with dissociative amnesia, it's real. This condition isn't about just forgetting your keys or someone's name. It's when your mind blocks out important personal memories, usually because those memories are too painful or stressful to handle. Imagine your brain pressing a pause button on your past to protect you. It's not on purpose, it just happens. So, instead of normal memory loss from aging or a bump on the head, this type of forgetting is emotional. Have you or someone you know ever mysteriously lost time or personal history? That could be a sign. So what causes the brain to shut down memories like that? It usually comes from intense stress or trauma. Think of it like a computer crashing when it's overloaded. For example, someone who survived a car accident, went through abuse, faced war, or lost a loved one suddenly might develop dissociative amnesia. The brain says, "This pain is too much. Let me hide these memories for now." It's a natural, though extreme, coping tool. It mostly happens after events that overwhelm a person's ability to cope. For instance, a soldier coming back from combat might not remember entire missions. Or a child who faced abuse might not remember anything from ages 8 to 12. It's not faking, it's the mind's way of self-protecting. Could extreme stress in your life ever cause your mind to blank out painful events? The biggest sign is sudden memory loss, especially of personal facts, life events, or identities. But here's the twist: regular memory skills like reading, writing, or talking aren't affected. For example, a woman might forget she has 2 kids and how she met her husband, but still be able to cook, work, or teach others. Some people suddenly travel away, called a dissociative fugue, and start a new life without knowing who they were before. Imagine waking up in a hotel in another city with no clue how you got there or what your real name is. Others might remember general facts but not emotional connections, like recalling their wedding day but feeling nothing or doubting it happened to them. Do you know someone who seems spaced out, forgets big events, or acts like a totally different person sometimes? Doctors don't use a blood test or scan to find this. Instead, they talk deeply with the person and rule out other causes like brain injury drugs or Alzheimer's. The key is that the memory loss is psychological, not physical. A therapist might ask, when did the forgetting start? Was there trauma? Are other mental conditions like depression or PTSD involved? Treatment mostly involves psychotherapy, talking safely with a trained counselor to gently bring back memories without causing more pain. For example, a man who forgot his past after his brother's death might slowly recover memories through guided therapy sessions. Hypnosis or medications might help in some cases, but therapy is the main path. Healing takes time and trust. Would you feel safer talking to someone you trust if you lost memories of your past? You can't always prevent trauma, but building emotional strength can help. Imagine your mind like a muscle. The stronger it is, the better it handles stress. Supportive relationships, talking about feelings, and coping skills like deep breathing or journaling can make a big difference. For kids, safe homes and emotional care are powerful shields. If someone is going through a tough time, like a divorce, job loss, or violence, getting therapy early can stop small issues from turning into mental blocks later. Think of it like a vaccine for the mind. Emotional support builds resilience. Do you have someone you can talk to when life feels overwhelming? Recent research shows that dissociative amnesia may be more common than we thought, but often goes undiagnosed. Brain scans like fMRI now show differences in activity in memory-related areas, like the hippocampus and prefrontal cortex, when people with dissociative amnesia try to recall lost events. It's proof that the memory isn't gone, it's just locked away. Scientists are also testing therapies using virtual reality to safely guide people through traumatic memories. There's growing understanding that this isn't rare or imaginary. It's real and needs proper care. A 2023 study found that many people recover memories over time with support. So hope exists. Can you imagine a future where therapy helps unlock lost memories in a calm, safe way?